In 2025, the Georgia-Cumberland Conference camp meeting theme is Be the Church. In our Lest We Forget History segments, we will look at several different types of ministries that will assist you to live out your opportunity to be the church. Health ministry has long been part of the Seventh-day Adventist Church, even being called the right hand of the gospel and of the third angel's message. And that partnership is seen throughout the history of the Georgia-Cumberland Conference. After the first Seventh-day Adventists begun ministering in the Southern Territory in the 1870s, it was not long before health ministry-based outreach followed. Graysville, Tennessee, the site of so much early Adventist work in the Cumberland Conference in the South, was also the location of the first health sanitarium in that area. It was open for business in 1907 and worked closely with the Southern Training School. This school and sanitarium combined to teach coursework that included nursing and treatment room instruction, which was also included in the instruction at the original AdventHealth institution in Battle Creek, Michigan. One of these Battle Creek treatment rooms was already open in Knoxville, Tennessee. In 1905, Raymond and Delia Lovell, two Battle Creek trained nurses, opened these treatment rooms in prime locations in downtown Knoxville. Delia said,
"We were strangers in a strange land with no money, and we began by teaching the people to the principles of the simple life. If people would only eat plainer food and take the needed rest and sleep, they would find themselves improving mentally, morally, physically, and spiritually."
The treatment rooms provided electro-Turkish and the newer Russian baths, hydrotherapy, Swedish massage, electric light baths, and other treatments, as well as a vegetarian cafe. This method of outreach was an opening wedge to meet people in this major city in East Tennessee, and it was reported that a good impression was being made upon the leading groups of the city. With this added outreach, a school was soon opened to collaborate with the church, and this treatment room continued in the Knoxville area for nearly 30 years. Another major city that received a health emphasis was the growing metropolis of Atlanta. In 1903, Dr. Charles F. Curtis, who had previously worked as a literature evangelist, transformed the former Review and Herald building into the Atlanta Sanitarium. With just a small staff, this facility was able to give over 1,500 treatments in 1 year. It continued to expand and was advertised as using the famous Battle Creek Sanitarium system of treatments. Unfortunately, the ministry of the Atlanta Sanitarium was short-lived. It closed in 1915, just over a decade after opening. Many other health institutions have impacted regions across Georgia-Cumberland Conference for much longer periods. The city of Greenville in northeast Tennessee was blessed for many years with the Adventist-run Tacoma Hospital. This hospital was started when city officials approached the Adventist Church requesting the Washington Sanitarium to open a branch in Greenville in the early 1920s. This led to treatment rooms and a vegetarian cafeteria that was started by Dr. Harry Miller and Dr. Leroy Coolidge. A personal residence was converted into a small sanitarium that was soon much too small. Later, Dr. Coolidge opened Tacoma Hospital, which also included a training school for nurses. This institution was financed by grateful local businessmen. This medical center continued ministering to the Greenville community and strengthening the local churches until it was sold in 2017. Community leaders in Jellicoe, Tennessee, invited the Adventist Church through AdventHealth system to operate a hospital for their small town. The organization stepped out in faith, even though there was not one Adventist church in the community and not any church members within 30 miles. In 1974, Jellicoe Community Hospital opened its doors. Doctors and families started moving to the community, so within 6 years, the Jellicoe Seventh-day Adventist Church had formed and even started a church school. The hospital continued in Jellicoe over 40 years until 2015. One hospital that continues to make a difference is found in Calhoun, Georgia. The hospital originally started in 1935. In 1981, AdventHealth, then known as Sunbelt, agreed to manage Gordon Hospital. This arrangement continued until they were able to purchase the facility in 1994. In 2019, the name was changed to AdventHealth Gordon, and soon the other nearby facilities of AdventHealth Redmond and AdventHealth Murray joined with the 50 other AdventHealth facilities across the country. E.W. Dempsey, who has worked for the Georgia-Cumberland Conference Health Ministries for over 25 years, says,
"The book Christian Education, page 16, tells us, health is a great treasure, the richest possession that mortals can have. Our department is committed to sharing God's principles of healthful living, which serve as the right arms of the gospel."
But remember, these stories are just a small part of health outreach. Every church that has a cooking school, or teaches a New Start seminar, or takes blood pressures at the county fair is helping people to live a more healthy life and finding an opportunity to introduce people to Jesus Christ, the great healer.